and eventually became Chief Operating Officer. We didn't start out at a very large. We started out about 23 physicians.
Oh, wow.
And then till now it's over 100 physicians. And managing all of that while being scared, right? I don't know what.
Yeah.
And I've got a family at home that I'm trying to take care of, but I've got all this stuff here. So all that led to me seeing a cardiologist, having a stress test, having a very high risk outcome on that. 2 days later being and getting a stent. So I spent some time out in nature yesterday actually because I just so needed it. But as far as how it informs me is, I think maybe it's a lesson on space, a lesson on, and since I was in healthcare, I was the guy.
Right.
And I had trouble. I had all of these questions that no one seemed to be able to answer, roadblocks, and just utter frustration.
Yeah.
And if I was experiencing, how much more so people who did not have the background or knew who to call. It's easy to get jaded because I would think the other shaping experience would be COVID.
Right.
Sound like a real business term, but that's such a difficult thing to measure. So yeah, it was not a straight line.
It's a human experience that you're working with, the mechanical, manufacturing.
We need the structure, but be careful about who we're serving. Are we serving the process? Are we serving the structure? Are we serving the system? Or are we serving making sure the system serves us and the patient?
That's
right. I was like, I'm just really uncomfortable with a robot doing my surgery. And he said, it's not a robot doing the surgery. I'm doing the surgery. The robot's just helping me. I said, but yeah, it could turn on you. You gotta be careful about that.
It started after I had cancer, actually.
So how many leaves of lettuce is an egg worth?
Oh, it's usually a bag of lettuce for a dozen eggs.